pretty much everybody in the healthcare community realizes we're playing endgame with fee-for-service. Check and checkmate. Time to play a new and different game.
EvergreenHealth Partners believes the new game will be coordinated, value-based care. And it's creating a new model to provide it.
The Clinical Integration Network is a club of providers who want to work on quality and value improvement. The goal is really to grow the value-based contracting so that primary care providers can get paid better for what they do and to find a way to incentivize everybody to improve quality and improve value as we go forward. Creating tools that allow us to do that, that's what I'm looking for. And they have to be new tools because the old ones don't work.
The entire enterprise is driven by data, but different providers in the network use different electronic health records. So a critical issue is finding a tool that can make sense of them all.
So we have about 50 different electronic health records that we have both between our employed and independent practices that we're trying to work with. And so we were looking for a solution that would allow us to have one place where our care managers could log in, document, and have all the data they needed, whether it be claims-based or from the electronic health record. That was important to us.
We aggregate data from multiple EMR vendors across a network. It's really important that we understand what we're displaying in a patient chart in Wellcentive.
Evergreen Health turned to Philips Wellcentive not just for its expertise in data integration, but for its painstaking effort to understand what each record represents.
Every physician documents differently, and they document differently in a different EMR. Even in a single instance of an EMR, they could be documenting differently throughout the chart. So what Wellcentive does is actually bring in all of that data, put a standard and a normalization to it, such that the data is of high quality.
On a day-to-day basis, we see data inside of the Wellcentive application that we never have had access to before on such a broad scale. So it allows our care managers to see data elements that would have been siloed inside of someone else's EMR.
The ability to normalize massive amounts of data unleashes the power of Philips Wellcentive's unique care management solution. It's a sophisticated population health tool that doesn't require a physician's time.
Wellcentive helps work in the background to improve the value of what we do by doing add-on functions that we're not currently doing. So that's kind of a miracle.
Data-driven, efficient care management is not only better for patients, it's better business.
It costs $7 a minute to run my clinic. If you can save me 1 minute or do something offline that doesn't take my minute, both of those things save me $7 for every minute used. So, reducing doctor overhead and allowing a function to be added on that doesn't currently exist, that's an awesome tool.
The benefits to this approach are not just theoretical. They're quantifiable.
We've reduced the hospital spend on healthcare insurance for their employees from in 2015 back down to 2009 levels. To roll back the cost 6 years is pretty awesome.
Results like that are helping to convince more providers about the benefits of joining the Evergreen Health Network.
Our providers were initially a little bit skeptical that we might actually make change occur. And now that we have shown that we can improve even in the space of a year, they are very interested now. They really want to be part of this.
Evergreen Health recognizes that transforming healthcare also requires changing behavior. Personalized data can be very persuasive.
When we build this tool, what are we building it with? Well, it's the doc's own data.
So being able to access that information from multiple provider practices in one system is incredible. We can communicate that metric performance out to our provider groups very easily, so they always know exactly where they stand and how they compare to the other providers in our network.
So when we benchmark doctor behavior with real analytical tools, they change without much effort.
Coordinated care, fueled by accurate, actionable data. A big reason Evergreen Health chose Philips Wellcentive.
I haven't heard anyone yet in the entire company that thinks that we didn't make a really smart decision in choosing Wellcentive.